Welcome Trinidad and Tobago to our News 4 report, a product of the Government Information Services Limited and the Ministry of Communications. I'm Nicola Barito. Let's take a look at the headlines. Public Administration Minister announces plans that will see returning national scholars fill employment vacancies in the public sector. Cabinet agrees to put forward a land for the Landless Policy. And the Health Minister says his ministry is continuing to push forward with its agenda to curb the chronic non-communicable diseases. Thank you for joining us. Public Administration Minister Carolyn Sipasad-Bachan has announced plans that will see returning national scholars fill employment vacancies in the public sector. The initiative will see scholars work for 2 years as associate professionals before securing permanent jobs within the public service. She made the disclosure during the weekly post-Cabinet media briefing held on the sister isle, Tobago.
Cabinet has agreed to increase the provision of jobs for returning national scholars. This according to Public Administration Minister Carolyn Sipasad-Bachan, who says finding jobs for these persons is a need government has taken into consideration, and as a result, government will absorb these persons into the public sector.
563 national scholars who will be returning this year will be absorbed into the public service. At this point in time, they will start off with the AP program, and that, as you know, is what we call the Associate Professional Program. It runs for 2 years, which gives the returning scholar an opportunity to actually get an internship in the public service before being transitioned into a permanent position.
Minister Bachan explains that under this program, persons would work for 2 years as associate professionals before securing permanent jobs within the public service.
In addition to the 400 that are right now in the public service, in fact, out of that 400, approximately 146 of them have already transitioned out of the AP program, the Associate Professional Program, into positions in the public service.
This year sees an increase in the return of scholars who have pursued studies in library science and medicine. Minister Bachan says jobs have been created for them through the collaboration of all government ministries.
Out of that 563 returning scholars, approximately 160 are teachers and library science returning scholars, meaning that 160 teachers, close to 160, some of them being in library science, but all 160 will be absorbed into our education system. In addition to that, 120 medical doctors will be absorbed by the Ministry of Health.
The minister adds that Cabinet has also taken into consideration the setting up of new mechanisms through the guidance of the Service Commission and various ministries that will see the filling of vacancies in the public sector. Kimberly Ramkalawan, News 4.
In an effort to provide for homes for low-income persons, Cabinet agreed to put forward a land for the Landless Policy. Under this policy, state lands would be sold as residential lots for home construction and will target regulating of squatters on state lands at the same time. The Honourable Housing Minister, Dr. Rudal Munilal, made the announcement during the weekly post-Cabinet media briefing held in Tobago.
Government will soon put forward a policy titled Land for the Landless, as it seeks to make lands more accessible for persons who do not qualify for housing but are in position to qualify for a plot of land. In addressing the weekly post-Cabinet media briefing at the Cocoa Reef Hotel Tobago, Housing Minister Dr. Rudal Munilal says the policy is in keeping with government's medium-term framework to reduce poverty and develop human resources.
The objectives of the policy is to produce residential plots at an affordable price to satisfy the demand of the landless poor, to utilize state land resources on a sustainable basis, giving economic viability and ensuring that social and ecological sustainability are given equal emphasis in the allocation of state land.
While the process is scheduled to commence in August this year through the Land Settlement Agency, Minister Munilal says it's part of government's development of proper community life across Trinidad.
This policy will ensure that land is allocated for non-residential uses such as community facilities as well, religious institutions, community-based organizations, and NGOs. We will begin a process as early as August 2012 of developing on the existing squatting sites through an infill expansion program. This program will be undertaken by the Land Settlement Agency, mandated under Act Number 25 of 1998 to regularize over 251 squatter sites across Trinidad.
Several areas have been identified for development, including Cocorite, Golconda, Moruga, Point Fortin and Princestown. Minister Munilal describes these locations as greenfield sites suitable for the expansion and development of communities. Currently, there are over 129,000 applicants for houses. Under this program, the ministry hopes to alleviate some of the backlog of requests for housing units through the provision of vacant lots to low-income citizens for sustainable development. Kimberly Ramkalawan, News 4.
News 4 continues after the break. Stay with us.
The iPhone 4S has an all-new camera with 8 megapixels and advanced optics. So it lets you capture stunning photos. And because it's an iPhone, you can do things you never imagined possible with a camera. So maybe the only camera you need is the one on the most amazing iPhone yet.
Welcome back. The Honorable Health Minister, Dr. Fuad Khan, says his ministry is continuing to push forward with its agenda to curb the chronic non-communicable diseases through its national Fight the Fat initiative, among other high-profile mass media campaigns. He was speaking at the opening ceremony of the Ophthalmology Society of the West Indies annual conference, where he highlighted that these diseases are, in fact, the leading causes of death in this country.
Diabetes, heart disease, strokes, and cancers account for 4 out of 5 leading causes of death in Trinidad and Tobago. These chronic non-communicable diseases are responsible for 60% of all deaths in this country. In addition, Trinidad and Tobago has the disquieting honor of being the country with the highest rate of diabetes in the Caribbean, with a prevalence rate among adults approximately 12% to 13%. That is 1 in 8 adults have diabetes.
The health minister says the fact that there is a large number of the population with cataracts is closely linked to the high prevalence of diabetes in Trinidad and Tobago. He adds that cataracts and glaucoma have been found to be twice as common in patients presenting with diabetes than those without.
Diabetes is not only a major cause of admission to our hospitals, as there are many other health complications, depending on the World Health Organization studies. After 15 years of diabetes, among 2% of people become blind and about 10% develop severe visual impairment.
The minister is assuring that his ministry will be taking steps towards creating more public awareness on the severity of the situation and how an adjustment to lifestyles can make a huge difference.
The Ministry of Health continues to push ahead with its agenda to curb these chronic non-communicable diseases through our Fight the Fat initiative, with aims to educate the national community about chronic non-communicable diseases, healthy lifestyles, and knowing their personal statistics. As the year progresses, you will continue to hear more about this program, and we have a large, healthy program planned for Sunday, August the 12th in the Queen's Park, Savannah.
Meanwhile, the minister is identifying the area of eye care as a pressing issue and says the Ministry of Health is hoping to address the lack of data on eye health and blindness. He says several important developments have occurred recently, specifically the establishment of a DM ophthalmology program and a BSc optometry program at the University of the West Indies. He says this means that the local eye care professionals of tomorrow are now being trained here at home.
This provides a new opportunity to train staff to deliver high-quality eye care, tailored to the specific needs of Trinidad and Tobago, and it makes planning of this study extremely timely. There is an urgent need to understand the prevalence of blindness and visual impairment in Trinidad and Tobago in order to provide an evidence base on which to structure delivery of resources. The NES City project involves randomly selected hundreds of households in the country to achieve a given sample size, which will allow us to estimate the prevalence of visual impairment and blindness. In summary, the NEST survey will achieve the following objectives: establishing the age and sex-specific profile of ocular diseases among the age 5 years and greater. It will establish the prevalence of eye diseases, which includes cataracts, glaucomas, diabetic retinopathy, uncorrected refractive errors. It will also perform a knowledge, access, practice, and behavior belief study, and will identify the ocular disease for treatment, which is the service component.
Veena Bharath, News 4.
In related news, Trinidad and Tobago is ready to embrace organ transplantation. The Honorable Health Minister, Dr. Fuad Khan, spoke of several plans being undertaken by his ministry to promote awareness of the significance or the significant benefits this procedure can have in Trinidad and Tobago.
The health minister is announcing that hundreds of lives can be saved, as well as millions of dollars in the area of dialysis if organ transplantation is practiced in this country. The minister is therefore making an urgent call for persons to become a registered organ donor and help save lives. Dr. Khan adds that medical training is currently ongoing in this country via arrangements with other foreign healthcare professionals.
We are improving the skills because we have arrangements with the Spanish Barcelona Institute for transplantation training for harvesting, as well as recipients and donor training. So we have that going on right now. It's about a 2-year program, and another program where the Spanish people will be coming assisting us. Cost factor is not that costly. It's much more costly to keep somebody on dialysis indefinitely. At $900 a dialysis, time 3 times a week, multiplied by a month, multiplied by 10 years. It's much less costly to put somebody on a kidney transplant program.
Dr. Khan says campaigning will be a major part of his ministry's plan to promote the great benefits of organ transplantation, and admits that many citizens are not fully aware of the positive impact it can have. He adds that information on the legal aspects and fine details on the procedure will help clear the air on any misconceptions of the general public.
Everything is a campaign. Everything is a campaign, and if the campaign and the education is done in the correct manner, the marketing of the campaign and marketing of the need for organs and the way the organs are done, if I'm dying, I'll be first. I'll be the first to sign right now. Take all my organs. That's what you need. I'll sign the paper once it's there. Corneal transplants are very, very necessary to allow good sight. And kidneys, if the kidneys are good. If you're dying, and you're brain dead, you can use these organs because they're well perfused and they're disease free. But there has to be a protocol where these organs will be able to be harvested without the unnecessary move to say that one is doing illegal activities.
The ministry is also planning to sensitize persons about the organ donation card, in which the information about the intended donor is inserted at the back of an identification card or driver's license. Meanwhile, Dr. Khan assures that the local medical facilities are prepared to embrace such procedures. He adds that the registration process to become an organ donor is quite a simple one, and persons are advised to visit the ministry's website www.health.gov.tt for further information.
They're ready. I participated in about 20 transplants, and it was normal operating theaters and normal donors. We were thinking of a legal document and a driver's license, which might be easy, or some other way that we could get that into the system. Because if children organs are used, but children who are in accidents, etc., and young people organs, they're much better used and harvested than older people with diseased organs.
Veena Bharath, News 4.
More news after the break. Stay with us.
I bring a message of peace. P-E-A-C-E. It's about patriotism, environment, and citizenship education, calling you or youths between the ages of 14 to 20. Become a trainee in the peace program nationwide.
just 6 weeks of peace training starting 9 July.
Come join us 2 days a week.
From 9 to 3.
Over the age of 18.
You want to be an instructor in this program?
Your training starts from the 25th to the 29th of June.
Interested in becoming a trainee or instructor?
You can call us at 625-2652 or 625-9557.
Or visit us online at peaceprogram2012@gov.tt.
The Peace Program.
Promoting patriotic citizenship.
An initiative of the Ministry of National Security for the 50th anniversary of Trinidad and Tobago's independence.
Welcome back. The Central Statistical Office and the United Nations Development Program Trinidad and Tobago Office have collaborated to produce the first Trinidad and Tobago Human Development Atlas 2012. In launching National Human Development Index Atlas, Dr. Botiwari, the Honorable Minister of Planning and Sustainable Development, said the report will enable government to make better decisions with a more targeted focus.
The first Trinidad and Tobago Human Development Atlas 2012 has been launched, and statistics reveal most of eastern Trinidad has been vulnerable to poverty and lowered levels in education. The project was as a result of collaboration between the Central Statistical Office and the United Nations Development Program Trinidad and Tobago Office, and covers statistics as recent as 2010. In revealing the data at the launch of the report, Planning Minister Dr. Botiwari says the figures reveal an inequality in the distribution of resources that have long existed, something government is currently working on alleviating.
The patterns of development are not the same for all Trinidadians and Tobagonians. Poverty-stricken areas are concentrated in pockets in the northeastern, east and southeastern parts of the country. And it is important to document that, show it, so that interventions can be made and so that the country can be satisfied that you are doing the right things for the right reasons. Uneven levels of development generally have an impact on women, and here in the Caribbean and Trinidad and Tobago, our youth. Patterns of inequality exist in income, education, and life expectancy. Those are issues that we must address as an issue of equity. The eastern regions of Trinidad have the lowest national human development indices. I would not have known that had I not seen the figures.
The Atlas includes the first National Human Development Index, Inequality Adjusted National Human Development Index, the Gender Equality, and the Multidimensional Poverty Index. Minister Tiwari said the Atlas will aid government to focus its resource allocation to regions identified as being in dire need.
We are able to identify clearly the regions where poverty is highest or lowest, or where crime is more of a problem or is perceived to be. We are able to highlight discrepancies among the various regions, and these permit us as policymakers to ask questions about how resources are to be allocated to tackle national issues or regional issues. More and better information can support better decisions with a more targeted focus.
He noted that so far several government initiatives have been implemented in an effort to reduce the impact these issues have on society.
The Ministry of Planning and the Economy is playing a role in alleviating many of these issues. How do you do that? How do you intervene? The percentage of the population living with chronic illnesses is alarming, and government has had to take this into account in making the management of chronic diseases a central thrust of our health policy. This is something that we did based on the information that has been gathered here within the last, might be 3 or 4 months.
The 182-page National Human Development Index Atlas is the first of its kind published by the CSO and boasts of a unique collection of maps depicting a comparative spatial analysis of human development at the country level, and is separated into the 15 regional corporations. Kimberly Ramkalawan, News 4.
The Americas Federation of Netball Associations Championship kicks off in Port of Spain with an opening ceremony, followed by the first 4 games of the competition. The Trinidad and Tobago Calypso girls are the defending champions, and they are ready for all challenges. The Jean Pierre Sports Complex is the venue for the championship, and the News 4 sports crew was there as the players went through their paces. Wayne Cunningham has more.
These are the women of the Trinidad and Tobago senior netball team who are set to defend their America's Federation of Netball Association's title when the championship jumps off at the GPS Sports Complex on Saturday. The experienced Rhonda John Davis told us what we could expect from the Calypso girls.
Every time we take the court, we go expecting to win, and we play hard and just expect that. That's all we can give our best. We were once world champions, and we're presently the highest ranked team sports in Trinidad and Tobago. So I think that is this opportunity that Trinidad is being afforded right now to actually see us in action. I think it's a once in a lifetime opportunity, and I think that we should take it.
Some familiar foes are expected to be our main threats, but the hard-working John Davis is well aware of their capabilities.
Well, Jamaica, of course, but Barbados, they are coming in match ready. They played in England recently, so they are coming in match ready. So I believe that they would give us a fight as well. And St. Lucia, they are being coached by Connie Francis, who was Jamaica's coach, previous coach, and so I expect them to come with some of Connie's style of play as well. And also USA is not a easy team. I don't think any of the teams are going to be like an easy walkover, but they're going to have harder teams. So Jamaica, Barbados, St. Lucia, USA.
Captain Candice Guerrero agrees with her teammate, but is wary of all comers.
More harder teams would be Barbados and Jamaica, but we're not looking at any team lightly. We go hard for all games.
The captain is certain that home support is what will make the difference.
We are sure to give them a performance that they would enjoy. We would put our best foot forward. All in all, support, encouragement does a lot. It carries a team a far way.
Versatile attacker Joe Lisa Cooper is also calling for Trinidad and Tobago to come out and support the team.
We have a lot to offer, and all we need is your support. That is all we need. We just need all to just feel that we have some behind our backs. We need encouragement. Yeah, that's all we need, because we're in our hometown, so we need to represent.
And according to Rhonda John Davis, they can't wait for the opening whistle.
Just ready to play. Everybody just ready. Can't wait for the tournament to start and see what happens.
Once again, a national team is calling for our support. Let's not disappoint. Wayne Cunningham, News 4 Sports.
We take a break and come back. Stay with us.
Homo sapien, we'll call him Mark. It spends its days trying to attract a mate. Success. What follows is a series of celebratory actions unique to this species. Every Homo sapien has their own way of displaying themselves to attract a female. But things don't go according to plan.
Where the water gone?
No water, no love. Pay your water bill today.
The Water and Sewage Authority of Trinidad and Tobago. Water security for every sector. Deliver it, sustain it.
Welcome back. The National Information and Communication Technology Policy and Strategy Conference has come to an end. The two-day conference was held to facilitate discussions on issues related to information and communication technology in the country.
Minister of Science and Technology, Dr. the Honorable Rupert Griffith, says information and communication technology is important if the public is to fully avail themselves of the services offered by the government. Minister Griffith was speaking at the 3rd Annual National ICT Policy and Strategy Conference. The conference served as an outlet for government ministries to present on their ICT-related initiatives. Minister Griffith says a robust ICT sector benefits citizens as it allows them to access health, education, and state assistance with ease.
Here in Trinidad and Tobago, we can readily see this through initiatives such as TT Connect, which enables citizens to access and apply for government and state agency programs and services online via their mobile or through the TT Connect Express, a mobile office on the go powered by ICT. ICT, therefore, offers government the ability to reach more citizens nationwide. Citizens themselves gain much from the devoted ICT sector, such as greater access to primary services, such as health and education. Education in particular can be seen to be made more available to the public as distance learning and online tuition offers citizens greater opportunities to self-employment and an ICT-empowered society.
Dr. Griffith adds that ease of access to state programs isn't the only benefit citizens receive. He points out that as ICT develops, so does business efficiency, which leads to lower costs and lower prices. He points out that as ICT develops, so does business efficiency, which leads to lower costs and lower prices.
A developed ICT sector will prove a significant driving force for improved efficiency in business sector as ICT tools allow the more efficient, innovative, and productive use of resources by entrepreneurs and businessmen. Easier transfer and management of information make for more efficient process and operations, which results in lower operating costs, a scenario that benefits both merchant and the customer alike.
Gregory McBurney, News 4.
Well, that's how we wrap up this edition of our News 4 report, a product of the Government Information Services Limited and the Ministry of Communications. I'm Nicola Barreto. Thank you for joining us.